Approximately 1 out of every 3 people have a herniated disc. Back in the day, though, we didn't know that because we didn't have the advent of an MRI. MRI is considered the gold standard of soft tissue imaging because it'll show you, it won't show you bone as well, but it'll show you what muscles are doing, what discs are doing, what ligaments are doing. And what it does is it orients the molecules so that all the water is facing the same way. So let's say I've got a swollen wrist and I get an MRI of it, all that white fluffiness from the water will actually show up and it'll show me this white picture. So what happens on MRI is that the picture changes based off of what's hurt. So now that you know that, let's talk about discs. How do you herniate a disc? The best way to herniate a disc is to bend and twist at the same time without paying attention, not being mindful. So for example, let's say I want to pick up this mouse. Doing this with the bend and twist, not a great idea. If I want to pick it up, get right in front of it. Bend properly, pick it up, because that's the best way to do it. Time-wise for the day, what's the best time to herniate a disc? Early in the morning, because that's when you're most hydrated. You've just been sleeping all night. All those discs are as stiff as they're going to get. Throughout the day, gravity and movement is going to compress them just a little bit. But if they're really stiff in the morning, then it's an easier time for them to break. What does a disc look like? It looks like a jelly-filled donut, where the middle of it is a softer material and the outside of it is much more fibrous. Now, if you were to just put a little bit of pressure on a jelly-filled donut, you would get a bulge. So some people will have a disc bulge, and those can absolutely resolve if you do things like traction, stretching. You can even get on an inversion table, chiropractic, Pilates. All of those things can really help you with a bulging disc. If the bulge gets too big and the actual material from inside the disc comes out, we call that a herniation. This is where it gets really crazy, because if you herniate something but you're not anywhere near a nerve, you're not going to notice it. But if you herniate a disc next to the nerve, then you're in trouble. Now here's what people don't realize, is if you have a herniated disc, right, and now I'm eating cookies, candy, junk food, you are inflaming that disc so much more because all of those cause inflammation. Now let's say I decide I'm going to clean up my diet. I'm going to eat greens. I'm going to eat all clean stuff. I'm going to get rid of all the breads, the fried food, all the ice cream. The disc can actually resorb a certain amount. Is it going to go back to perfectly normal? Probably not, but it can still heal. So when you're looking at a disc, the bulge is just when you're putting pressure on it. When the stuff actually comes out of the middle, that's called a herniation. If the herniation gets really big and this piece of disc actually breaks off, that's called an extrusion. That means the jelly donut piece is no longer connected. If it's just still attached, we call that a protrusion. Both protrusions and extrusions can both be a royal pain. Extrusions, depending on how big they are, sometimes the body resorbs them. Sometimes you have to get an epidural. Sometimes you have to take anti-inflammatories. But eating clean will help all of those conditions to at least a certain extent. I mean, you might need some intervention. What's another thing that causes disc herniations? People not being mindful of their core. The word core is actually Latin for heart. It's your second heart. It is the center where everything comes from. So if you were to suck your belly button up and in, that point between your belly button and the spine where everything sticks out, that one center point is your epicenter. That is the center of core. That point is where everything should rotate around, bend around, move around. It's the one point that you should always keep stable. Even when I'm sitting on this ball, I have that belly button sucked up and in. So if you're someone with a herniated disc, the first thing I'm going to tell you is watch your posture. When you are sitting, when you are standing, stay off of soft, squishy couches because they make everything asymmetrical and they make everything not biomechanically supported properly. Do I love a nice, soft, squishy couch? Yeah, because it brings me patience. But other than that, no, you should not be on one of those. If you do have a herniated disc and you're having radiating pain from it, get into a chair that has a back. If you notice I'm sitting on this physio ball, this is my favorite thing on earth to sit on because even sitting on it creates balance, movement. There are these tiny muscles that are on the spine. They're called multifidi and rotators and interspinalis muscles. They're tiny. The only way to exercise them is through posture things. through balance things because they're postural stabilizers. So if you have a herniated disc, eat clean. Make sure you've got that belly button sucked up and in. If you haven't seen a chiropractor or an acupuncturist or a PT, a combination thereof, I highly suggest you do it. And different things will work for different people. If you have a herniated disc and you have the MRI, that's where it gets really fun, because then you can see exactly which way that disc is herniated. So for example, if I herniate this disc on the left-hand side, I might find that I'm leaning away because I don't want to put more pressure on that. So you'll see people who lean. So if you're one of those leaners where you're like, oh, I'm leaning forward, oh, I'm leaning sideways, that gives you a clue as to where your disc is located. If any of those are you, lots of natural anti-inflammatories, be mindful of your posture. You can use kinesiotape, you can use cupping, you can use acupuncture. There is a huge toolbox of things that you can use. The question is finding the ones that are right for you.